Hello and welcome. Welcome to Drug Rehab Made Easy. My name is Dr. Anthony Dupree. I am a physician with over 30 years' experience with treating people with addiction. I believe that there is a simple pathway to drug rehab. Before we talk about this simple pathway, I want to acknowledge that there are many other paths to recovery. There is Alcoholics Anonymous with their 12-step program. There is individual and group therapy methods. There is substitution therapy. In this approach you replace the drug that you're addicted to with another. The examples of this type of therapy is methadone and Suboxone treatment. There are faith-based approaches. This is usually a Christian-based approach. There is a mindfulness approach to drug rehab using Buddhist principles. I hope in the future to give you a presentation on this topic. Now, before I give you the overview for this course, let me begin by saying that if you have other options for drug rehabilitation, you should use them. This course is targeting those who don't have options. It's for you out there who can't get into a drug rehab program for whatever reason. Maybe you live in a small town and there's no treatment options in your community. Maybe you don't have the money. Maybe you don't have insurance or the right type of insurance. Or maybe you're in a relationship with someone who's in complete denial. They may be refusing to get help. They may be angry at you for bringing up their addiction. You may be watching the self-destruction of someone. You may be watching them lose everything. You may not know what to do. This course will give you options based on the evidence. So, let's get started. We are going to make 4 assumptions. The first is that drug addiction is a habit. The second is that everyone, including you, can break this bad habit. The third is that changes in habit happens in steps. This last part is critical. You see, if you're in a relationship with someone who is using drugs, you naturally want to focus on them stopping. But if you don't understand the steps that lead to them stopping, you will fail. Your goal should be to get them to the next step and then the next step until you get to the final step. The fourth assumption is that relapse is part of recovery. It is not a failure. In other words, the steps leading to recovery is cyclical. In time, the intervals between the relapses will get further and further apart. Eventually, you will stop relapsing. But you will always need to be on your guard. Well, are you ready to get started? Let's begin with 5 questions. The first question is, are you still using drugs? The second question is, if you're still using, are you thinking about quitting in the next 6 months? The key word here is thinking. It doesn't mean that you have a plan to get there. The question is, do you have a thought or desire to stop in the next 6 months? The third question is, are you planning on quitting in the next 30 days? The fourth question is, have you ever been able to stop using for 24 hours in the last year? And the last question is, what's the longest you have ever been able to stop in the last 2 years? How you answer these questions will give us a hint as to how close you are to kicking the habit. Over the next several classes, we're going to break this down for you. We're going to review your answers, tell you what it means, and give you strategies for self-help. See you soon.